Today, April 7, 2021, at Pelita Hospital, the nurses on duty on the night shift and morning shift are having a morning meeting which will be held at exactly 7 a.m. with the head of the room and the team leader. After that, it is continued with a pre-conference. After completing the morning meeting and pre-conference, Nurse Akisa and Nurse Konchoro are in charge of Dahlia's inpatient room to immediately carry out the nursing action that have been planned in the morning meeting and pre-conference, namely the installation of a catheter.
Kisa, I have all the equipment for catheter placement to be performed on the patient on behalf of Miss Chacha and Mr. Anjar have been prepared.
I have prepared all the equipment needed for catheter placement in the nurse station. I don't forget to meet the patient family and explain to them the patient will have a catheter procedure. And also the concurrent information must be speed. We have a patient.
I will meet Mr. Anjar's family. Miss Chacha will be handled by Nurse Akisa, right?
Alright, Nurse Kunchoro.
After that, Nurse Kunchoro and Nurse Akisa meet with the patient and family to explain if a catheter would be installed according to the doctor's instruction.
Please let me introduce myself first. I am Nurse Akisa, and this morning I am on the morning shift. Could you please introduce yourself?
Good morning, nurse. I'm Chacha and I'm 21 years old. My address in Kasihan, Bantul.
Well, Miss Chacha, today I will explain about the nursing action that will be taken. And your mother, would you follow me explanation? So everyone can be understand and agree with the action that will be taken.
Will whatever is best for my brother, I can accept it.
So the action that will be done is interesting a catheter in Miss Chacha urinary hold the using a latex catheter because the use time is less than 3 weeks. The reason for Miss Chacha catheter procedure is that Miss Chacha has just undergone ORIF surgery on both left and right femur bones and has to be completed with rest. Is Miss Chacha ready for use to install a catheter procedure?
I agree to be given action.
We will improve the service of the aseptic procedure so that the incidence of the infection can be minimized. In addition, we'll continue to monitor Miss Chacha personal hygiene.
I calm me down hearing the explanation given by Nursing Akisa.
Okay, then maybe Miss Verta can send an informed consent behalf of Miss Chacha. Thank you, Miss Chacha and Verta, for you guys cooperative. I will return to the nurse station to prepare the catheter in certain device.
Isn't there some kind of infection at the time my brother will give a catheter action?
Meanwhile, in front of the bed, Nurse Kunchoro was explaining the action and asked Anjar for a proof of the catheter procedure.
Please let me introduce myself, please. Today I'm on duty on the morning shift. Could you please introduce yourself?
Good morning, I am Anjar. Old is 50 years. My address is Kota Baru, Y in 5 Yogyakarta.
Will Mr. Anjar today I will explain about the nursing action that will be taken, and you will follow me explain, so everyone can be understand and agree with the action that will be taken.
Well, whatever is the best for my husband, I accept it.
So the action that will be taken is to install on catheter in the ureter hole. Mr. Anjar will be asked a latex catheter because the usage time is later the 3 week. Mr. Anjar reason for having this catheter action is to overcome the urinary reaction that is complaint of according to the doctor instruction. Are you ready for this action?
It's okay, agree, have a catheter installed.
I have a question. After installing the catheter, can my husband get an infection? I just read the article on Google. If a catheter is inserted, an infection can occur.
The risico of infection can arisen, ma'am, but we make sure to minimize to the risico of infection. The way is to insert a catheter with aseptic liquid and improve your personal hygiene.
I understand.
Okay, then Mr. Anjar can sing informed consent for catheter insertion. Thank you, Mr. Anjar and Miss Irma, for your guys' conference. I will return to the nurse station to prepare the catheter insertion device.
After all the approval action have been completed and Nurse Akisa and Nurse Kunchoro have carried out the catheter installation procedure. At 3 p.m., the morning shift nurse, head of the room, team leader, and afternoon shift nurse meet at the nurse station to carry out the pre-conference as promised at the meeting this morning.
It is good according to our agreement. If at 3 p.m. there will be a post-conference activity which serves as a discussion, please to discuss the result and follow-up of the nursing care that have been given starting from Nurse Akisa and their Nurse Kunchoro.
The patient I handled was Chacha, a 21 years old post-operative patient with ORIF. The operation was carried out last night 1 o'clock and entered the inpatient room at 6 a.m. with a conscious condition from anesthesia. The action took interesting a catheter because the patient had to be completed bedrest accordingly. The doctor introduced an informed consent can be approached by the patient with a signature on behalf of vertebral. The objective data shown were BP 130, 90 mmHg, temperature 36 Celsius, RR 18 per minute, 100 minutes plus. Then for urine output until 1430 Hz, a match has 20 to 160 cc.
The patient handle of behalf of Mr. Anjar is 15 years old with a medical diagnosis of urinary retention due to BPH. The patient complained of urinary retention. The doctor ordered catheter installation to morning. Prevention, the patient have valid and signed informed consent. The objective data waste visible activity 20-30 pass Nemen BP 114 per 100 temperature 36.2 RL 18 kali per minute plus 18 kali per minute for urine output until 420-30 pass. It is 100 cc.
Well, thank you to Nurse Akisa and Nurse Kunchoro for the report on today action. Next, do you have anything to ask from the afternoon shift to the morning shift?
Have the nursing on the morning shift monitor the state of the patient urine with a catheter insert?
For the state of urine of the patient, Miss Chacha and Mr. Anjar, we have filed it completed in the evaluation report. Later, Nurse Widya, can you check it first?
Have all of them been studied?
Assessment the fluid balance in the fish egg hole from 6 AM to 4:20-30 PM. The afternoon shift nurse can monitoring the patient fluid balance.
I think it is quite clear. Yes, the given information was from the morning shift for to afternoon shift. Good conference, the post-conference activities are now being carried out. There I return then to the head of the nurse room. Daniel to do the hand cover of patient from morning the evening shift.
Yes.
Assalamualaikum warahmatullahi wabarakatuh. Good afternoon everyone. Before we carry out the handover of our patients, let us pray according to our respective belief. Prayer is welcome. Okay, and now then I will first record the nurse on duty today. For the head of the implementation, Timbo is on duty today. There is Nurse Edo. Morning shift there is Nurse Akisha and Nurse Kunchoro. Then on the afternoon shift there is Nurse Vidya and Nurse Cinta for report on patient medical record intervention that have been carried out and will be carried on earlier. It was been well explained since the morning shift has finished carrying out nursing care to the patient. We will hand over the patient morning shift after this the patient work can go straight home, and afternoon shift can implement immediately carry out nursing action to patient. Now we will meet the patient and validate the patient that as will is carry out the handover. Let's go straight to the patient room.